Again, I'm Kelly McCutcheon. I want to welcome everyone to the Georgia Legislative Policy Forum. We're getting into the meat of our schedule. This morning, we're going to be focusing on health care with two panels. And this is our first panel, which is focused on employers. A lot of people don't realize, after government, large employers pay for most of the health care bills in our country. And it looks like insurance, but it's really not traditional insurance. It's really self-insured companies where they're actually writing the checks. And usually employers are fairly passive. They hire a TPA, a third-party administrator, to handle all the healthcare stuff. But every once in a while, there are employers that take an active role because you're tired of paying the 10 and 20% increases like all of us are frustrated with our premiums going up. This group has had incredible success with that. I'm proud of them because they're Georgia employers, and I think they can sort of lead the way in understanding these best practices that we can try to replicate in healthcare reform in other areas of Georgia. The group is called Employers Like Me. I've been following them for many years. The amazing, innovative
Test one, test two.
But recently got a chance to attend their conference down in Savannah about a month ago. And not only just amazed with the ideas they've had, but the collaboration. They sit around and just share, this worked, this didn't work, and they're constantly iterating and looking for solutions. So I thought it'd be really helpful for us as other employers can learn from them, but also the state of Georgia. The state of Georgia operates one of the largest employer plans in the country. 650,000 covered lives, $3.4 billion spent every year. That's a lot of money. And maybe there can be a public-private partnership to learn from what of our good Georgia employers are doing. The moderator is Don Betts. Don works with Georgia Tech, and keeping up with our theme of rural Georgia, he's from Douglas, Georgia, and he has been working in sort of coordinating the Employers Like Me for many years, doing a fantastic job. Don is the perfect person to coordinate this group. He has lots of knowledge in many different areas, is a great collaborator, and we're thrilled to have him and his colleagues here today. So please welcome Don Betts.
So I don't know about y'all, but the main takeaway so far is we've got to be careful. We cannot let policymakers and politicians from Illinois migrate to Georgia. Boy, that was interesting. I'd love to have him at my Thanksgiving table. It would be fun. You could probably get out alive. So, as Kelly said, I get the distinct pleasure of being able to staff this group of Georgia employers. And we have about 185 folks in our network. We've been rather low-key. It's a trusted kind of colleague-to-colleague type peer-to-peer learning network. And we really try to get together and share ideas, just as Kelly mentioned with our summit that we recently had in Savannah. Now, why are we doing this? There are all kinds of other organizations around health, and many that the employers are involved with. But what we find is that often the employers are outnumbered at any health meeting you go to. As policymakers bring together folks to talk about healthcare policy, they oftentimes forget about one of the biggest customers and really the biggest avenue to get to the other customers, and that are the employers. So we are together to work on that. The other way to look at this is think about if you were running your business and you had one of your main components of that business going up 10 to 20% every year. What would you do? Well, you know what you would do. You'd wrestle that thing down to the ground, you'd work your supply chain really hard, and you'd figure out how to cut that down and to get the best service possible. Well, that's what they're tasked with in the healthcare world. But unfortunately, what we find is that they're asked to do that with one hand tied behind their back because of some issues that we'll bring up this morning. So it's a very challenging world that they operate in. And I think it's something, if you don't take anything else away from what we talk about this morning, is that when you're thinking about legislative policy or just rules, regulations, procedures around health care, make sure that employers are at the table. Make sure some customers are there that can talk about it. My father a long time ago told me, said, son, the people that are doing something aren't going to change it. And, that's a real lesson I think that still holds true. And these employers have been able to come up with some very innovative practices. At first, I thought when I got involved with these folks, it would all be about price and cost. They quickly taught me that's not the case. It's about access to care, quality care, and then cost. And they've taught me that usually the best care is not the cheapest care. So it's not a group where we talk only about cost, it's how they can take care of their employees and be productive and have good, healthy cultures in their workforce. So with that, what I'd like to do is we have three great folks here, and you can see, of course, and I'm going to kind of do a quick introduction. Lisa Evans with Southwire, who's the Director of Living Well. Now that's a pretty cool title. You'll have to dig into that a little bit with her. And then Barbara Barrett, who's the Director of Benefits for Langdale Industries down in Valdosta. And then last but certainly not least, Kim Johns with Mohawk Industries, who's the Director of Employee Benefits. And I've had the pleasure of working with these three ladies for quite a while, and it's truly an honor to be with them and to have them here this morning. So what I'm going to do is ask each one of them to take about 5 or 10 minutes and tell us a little bit about some of their biggest challenges that they have and what they're doing. But then we want to leave a lot of time for some interaction and some questions with you. So be thinking about, here's your chance to talk to some of the folks that are in the trenches, that are really having to work through some of these issues and to make the healthcare system work for their company and for their employees. So it's a great opportunity for that dialogue. So without any further ado, Lisa, why don't you get us started?